Welcome again. My name is Olivia Bornick. I work for the United Way of BC. I'm the Assistant Director of Community Engagement within the Healthy Aging team at the organization, and really delighted to be in this space with all of you today. So thanks for joining us. And the topic of our webinar today is looking at extreme cold weather response. And we're really delighted to have Lisa Parrott with us from the Reach Community Health Clinic. I'll do a little bit more of a formal introduction in a few minutes, but Lisa is joining us today for our webinar, which will last about an hour. We have about an hour of time together and are really excited to listen to Lisa, learn from Lisa, and then really create an opportunity to share amongst ourselves too about different strategies and responses and mechanisms and approaches we may have all engaged with, or we may be testing in our own local respective communities as well, as we grapple with extreme cold weather and the vulnerabilities of different populations and individuals within our community spaces. So thanks for joining us. Ravi, next slide, please. Before we officially get started, I did want to take a moment to acknowledge that United Way conducts its business and does its work across the province on the homelands of multiple Indigenous peoples. There are over 200 First Nations in the province of BC around which United Way BC does its work. And we really honor and lift up our hands in gratitude to the territorial keepers of the land on which we have the opportunity to live and work. It really is a privilege to be in this space and have the opportunity to be grounded in this space. And though we don't have the opportunity to do a round of introductions in the context of this webinar today, I would like to invite folks on the call to take a moment to introduce themselves in chat if they feel comfortable doing so. And what I'd like to invite you to do is, if you feel comfortable doing so, put your name in chat. If you're connected to an organization, perhaps share your organizational affiliation. And if you know about the territories or lands from which you're calling in today, I invite you to also share that in chat as part of your introduction. So feel free to do that as we move through a few more housekeeping things, and then I'll turn it over to Lisa. So a few reminders in this webinar space. We're going to keep everyone muted just to ensure that we can all hear the presentation that's shared by Lisa. We do ask you, if you feel comfortable doing so, to keep your cameras on. It's really nice for the presenters and hosts to have a sense of who's in the room and visually see folks on the call today. That can be really lovely. It's obviously a different than gathering in person, but nice to see who we're in conversation with and learning from and listening to today. We will have a brief question period at the end of the presentation, but Lisa, who's with us today presenting, also said that she's more than happy to take questions as she moves through her sharing and her presentation. So you can post questions either in the Q&A box, and you see that coming up at the bottom toolkit of your screen, or you can also post questions in the chat function, where we're asking you to put your introductions right now. And those of us on the United Way team, so myself and my colleague, Laura Katawaki, and Ravi Gurwal, who's connected as well with the team, will be monitoring that and helping feed those questions up to Lisa if she's not seeing them on her end. So also, just as a note, the webinar is being recorded, and we will be posting this webinar recording on our Healthy Aging Core website and platform. We'll also be sharing out the slides from this webinar following the presentation. So with that in mind, if you, despite the invitation to keep your cameras on, if you feel uncomfortable about having your cameras on, given that this is being recorded and will be available on a website, then of course do what you need to take care of yourself and your own needs. I think that's it from my end in terms of housekeeping. We're going to move along now, and I'd like to formally introduce our presenter, Lisa Parrott, who's with us today. Lisa is a registered nurse and a public health coordinator at the Reach Community Health Centre, which is located on Squamish, Musqueam, and Tsleil-Waututh lands in East Vancouver. She draws on her clinical experience working with the emergency department at St. Paul's Hospital to inform her public health education workshops. She's also currently working towards a certificate in community capacity building at Simon Fraser University. And when she's not working in the space of and dreaming about public health, you can find her trail running, watercolor painting, or throwing amazing themed parties for her friends. I'm hoping I get an invite to one of those, Lisa. So really thrilled to have you with us on the call today, Lisa. I will turn it over to you. Thank you.
Perfect. Hello, everyone of United Way. I'm Lisa. I'm really happy to be here today and really grateful for the opportunity to present. Thank you, Olivia, for the introduction and and to Laura and Ravi for setting this up. I'm just gonna, now that you've seen my face, I'm gonna share my screen with you here. Here we are. Perfect. Now I hope everyone is seeing that A-okay. I'm here to talk about extreme cold weather response and health, what we can do to promote health and minimize risks in extreme cold weather. I promise we did not summon the snowstorm today. That was totally unplanned and just happens to be a really relevant day to be talking about cold weather response. Just as a quick overview of what I hope to cover in the next hour, just a couple little introductions, a little conversation about social determinants of health. If we had 3 hours, we could talk about all of the ways that the cold weather affects our health. There's so many ways that the winter provides challenges, anything from frostbite to mental health and seasonal affective disorder to respiratory viruses. So we could take this in a lot of directions, but today I just thought we would focus on hypothermia and fall prevention to explore those a little bit more in depth. And then hopefully we'll protect some time at the end for a collaboration session, which Olivia alluded to. I'm really hoping that we'd have a chance to share some ideas and to make use of the knowledge and expertise of people who were in the space. So stay tuned for more on that. I'm grateful for Olivia for acknowledging the land that we're on. I'm joining today from Musqueam, Squamish, and Tsleil-Waututh lands. And as I have been preparing for this workshop and delivering cold workshops across Vancouver, I think a lot about the Coast Salish nations who have been on these lands for thousands of years and truly are the experts at navigating winter conditions and changes in the climate to this area, really staying rooted in the land and in ceremony and tradition. So I'm really grateful to be on these lands, and I have a lot to learn from the Coast Salish nations. Also, just wanted to take a moment to be clear about what we'll be talking about today. I've seen some of your introductions in the chat, and that's nice to have a little idea of who's here, but I don't know your stories and what experiences you carry. And I just want to be clear that we'll talk about hypothermia, including what happens to the body as it develops hypothermia. We'll talk about people dying from hypothermia and about fall prevention. And if any of that content hits too close to home for you, I just want to extend a lot of love to you in this space and encourage you to take care of yourself, to step away if you need to and have a breath. Additionally, we'll see how much time we have for discussion. I hope we have a bit. I would just encourage folks in the room to be mindful of what you're sharing, just knowing that the words that we share have impacts on those around us. So let's be gentle to ourselves and to each other today. So a quick introduction. I'm working for Reach Community Health Center. For those of you who might not know, Reach Community Health Center started as a medical clinic on Commercial Drive in East Vancouver over 50 years ago. It's got a new shiny building, but it started long before the building was made. After being a medical clinic, it proceeded to open a variety of services to meet the needs of the community. So currently, we also run a pharmacy, a dental clinic, a urgent and primary care, which sees patients on a walk-in basis. And we also have a health equity and community engagement department, which is where I currently work and gives me the opportunity to do public health workshops and do community outreach to priority populations. So that's a little bit about Reach. Like Olivia said, a little bit about me. I'm a registered nurse. I have just come out of working in the hospital system. I was working at St. Paul's Hospital for 5 years, with the latter half of that working in emergency. And really interested in now working in the public health space to prevent people from going to the emergency department. I'm excited about health promotion and and meaningful health education. This photo here is me doing one of the things that I love, being out and about in the beautiful lands that we live on and near. And this is my partner's dog, who I like to take running with me. So we'll get into it. I find it's a bit challenging to talk about the effect of cold weather on health without really taking into account the full context. One of the words that we use in the land of health and public health is this expression, the social determinants of health. And so this diagram helps me understand that term. Towards the center of the diagram, we have sort of some of the individual factors that affect an individual's health. So we have their genetic code, and then sort of the lifestyle factors, such as how many vegetables a person eats a day, if they smoke cigarettes, if they drink alcohol, and how active they are. But as we start moving out in the diagram that you see on the screen, we get into some broader context factors that affect people's health. So there's the social and community networks, which a lot of us today are working in that space. This purple bar that you see here is what we often call the social determinants of health. These are sort of the non-medical factors that affect how an individual accesses health. So this covers everything from income to access to healthcare, to level of education. And then even more broadly, we have sort of general factors like economic policies and systemic oppression, even, and how that affects people's health. So the reason that I wanted to bring this up and just open with this today is sort of twofold. One is that obviously we're all affected by the weather, but not all of us experience the same risks equally. And a lot of that is driven by the social determinants of health. So poorer communities who are trying to save money on heat, or socially isolated seniors, or those with difficulty accessing health information online will all be people who have a harder time navigating cold weather because of these social determinants of health. The second reason that I'd like to share it is that I'd like to speak from what I know. I don't want to speak beyond the limits of my knowledge and experience. And my experience working in the emergency department and providing direct care has me able to speak sort of on a more individual level about how individuals experience the cold and what kinds of things we can do to mitigate risks. But I know I'm sitting in a room with a lot of community all-stars. And so I recognize that there's lots and lots of experience of folks in the room working on these social and community networks, and even working on the social determinants of health. I can speak a little bit to it because I've just come into this new space, but I just want to acknowledge that. And most of the content that I talk about today will be kind of more towards the center of that diagram. And I'm hoping that in the discussion time, we're able to talk about some of the broader layers as well. Related to this, jumping on, in this light, with this idea of the social determinants of health in our minds, I'm wondering if we could maybe use the chat function to brainstorm a little bit. I want to center the populations who are the most vulnerable, and I'm wondering if participants could name for me who are some of the most vulnerable communities to the health effects of cold weather. And if I was really good, I would be able to see the chat. Aha, there it is. Amazing. Perfect. Thanks for contributing, Clarence. Yes, seniors, the elderly definitely experience more of a risk. I see Phoebe sharing the unhoused. Thank you. Olivia adding the precariously housed, definitely. Yeah, people experiencing homelessness. Molly, thanks for sharing folks who live alone. Definitely. Social isolation is very connected to how we experience extreme weather. Yeah, I see health conditions there from Linda. Perfect. Thanks for sharing all those things, everyone. So yes, I think we covered a lot of them. I have up here a list of some that we talked about and a couple that we didn't. So we think about extremes of age when we talk about vulnerability to health effects of a cold. So older adults and also infants under 1 year more at risk. People with pre-existing medical conditions, specifically ones that affect the circulatory system. So individuals with heart disease, also individuals with diabetes, mental health conditions, as well as cognitive impairment. These are some of these medical conditions that in particular have an impact on experiencing health risks. So good to keep in mind. We mentioned in the chat folks who are unhoused or insecurely housed, communities experiencing systemic oppression or other forms of barriers to care also are going to be more at risk. Folks who use substances, including alcohol, substances affect the body in lots of ways, and that can be a whole conversation about what risks they have, but that's also a community that we want to remember and care for. Individuals who have disabilities, both visible and invisible, as well as folks with limited mobility, and individuals who are working outside or spending lots of time outside. Maybe that's even folks who are commuting for a long time outside just because of the fact of exposure. No, I just wanted to share these that we remember who we're focusing on and the people who are most at risk. Additionally, these are risk factors, right? So these components can stack. So not to say that every older adult is at extreme risk of hypothermia when they're outside, but an older adult who has pre-existing medical conditions, maybe some cognitive impairment, and maybe some limited mobility is going to be at an increased risk because of those few things stacking on top of each other. So let's get into hypothermia. We're going to do hypothermia and fall prevention, and then our collaborative session at the end. So hypothermia, it's about 25 deaths a year in BC are directly caused from hypothermia, and it's often the social determinants of health that play into these deaths from hypothermia. So low socioeconomic status and the elderly in rural settings are sort of the demographic that's most at risk. But beyond those 25 deaths a year, hypothermia also worsens a lot of other conditions. And so if it isn't the leading cause of death, it can still be an important factor in individuals' well-being. In the hospital, we see hypothermia sort of begin when the core temperature gets below 35 degrees. I think a lot of us in COVID times got a lot more familiar with checking our temperature, and we might know that sort of the average human body is around 37 degrees. So between 35 and 37 degrees is when individuals feel cold. You would feel genuinely cold if your core temperature was 36 degrees, but it's sort of about that 35 degree and below is when we start moving into what we call hypothermia. Of course, we probably know that hypothermia occurs from prolonged exposure to the cold. And it's really important to note in the context of the cold that being cold and wet is really a dangerous combination of things. Now, the wet could come from different places, that part of the equation. If someone fell into a frozen lake, of course, we would think they're cold and wet. This is dangerous. Their core temperature will drop quite quickly. But also, exposure to rain, especially in the area on the lands that I'm on, we get so much rain in the winter. And sweating is another very, very common way that people can suddenly have their core temperature drop. If they're quite active and they start sweating and then the sweat cools on their body, we can really see individuals' temperatures drop quite a bit with that. So pretty good to keep in mind that being cold and wet is a lot more dangerous than just being cold alone. And we all might be surprised to learn that hypothermia can actually occur at milder temperatures than you would expect. So in the data that looks at the deaths from hypothermia in BC, the average temperature on those days is actually 0.5 degrees Celsius. So it's not even below freezing. That's sort of a common place for individuals to develop hypothermia. Maybe it's a little bit that it's unexpected, right? If it's minus 20, a lot of us will dress warmly and really prepare, but it's quite easy to underestimate how cold it can be even at 0.5 degrees Celsius. Additionally, it's important to note that a lot of people, specifically elders, it's a common thing for folks to develop hypothermia at home, and it's possible. And it can sort of gradually develop if homes are even between 15 and 18 degrees Celsius indoors. So this is probably a bit of a higher range than we think, and quite a good thing to be aware of if you're supporting your communities. We really want to encourage, especially folks who have more risk factors, to sort of prepare for the cold, even if it's not that cold outside. And if they're able to try to keep their home temperature 18 degrees or above, because anything lower is going to be a little bit risky. The signs of hypothermia, we sort of categorize them into three levels: mild, moderate, and late hypothermia. And you can see from sort of the stars on the right-hand side of the screen, this is just for reference. You wouldn't be checking this in real life, but the different signs and different stages of hypothermia occur at different core temperatures of the body. So that's what I've indicated on the right of the screen. So early on in hypothermia, what we see, the first changes in the body are changes to how people think. The brain starts to get a little bit stressed from being too cold. Um, so a person who has mild hypothermia will still be alert and awake, but might show some early signs of confusion. Shivering is a normal bodily response to the cold. So a person with mild hypothermia will be shivering, but they just might not be functioning completely normally and might not have the insight to take care of themselves or recognize what's going on. So they might be a bit confused and might lack the ability to say, oh, I'm very cold, I need to do something about this. As the body gets a bit colder and colder, we move into moderate hypothermia. Here we see even more confusion, and then maybe the brain under stress from the cold starts to have some difficulty speaking, or some clumsiness as well, like difficulty moving around. A person with moderate hypothermia will also start to be a little bit sleepy, like can't quite stay awake, is quite lethargic. And at this point, a person may or may not be shivering. And I say may or may not because as we move into late hypothermia, the body actually stops shivering. It's too cold for the body to use its normal mechanisms that it uses to warm up. And in late hypothermia, someone will be unconscious and might have a slow or weak or even absent pulse and respiratory rate, so they might not be breathing. In terms of response to responding to someone with hypothermia, for example, if you go to check on a neighbor and you walk into their house and you notice it's quite cold, that they're a bit confused, they're still awake and walking around, but they're not acting normally. Really what we want to do is rewarm this person. There's no great surprise there. We want to raise the temperature of the house if we can. We want to get them out of the cold. We want to make sure they don't have any wet clothing on their body because, like I said before, that cold and wet combination is really dangerous. So we're going to try to remove any wet layers and we're going to bundle up with warm layers. You can apply heated blankets or hot water bottles as long as they're not right on the skin. And if the person is alert enough, encouraging them to drink warm, sweet fluids. A person, if we're doing all of those things, we would really expect that someone with mild hypothermia starts showing signs of improvement, like they become a little less confused and are able to be a little more aware of what's happening. If not, it's a very appropriate time to call 911 because their body could still be getting colder. As for moderate and late hypothermia, this clearly falls into the realm of a medical emergency. So if someone is extremely confused or is very lethargic and they're cold, you would notice that their skin is very cold as well. We're going to call 911 for this. And then there's just a couple pointers, just a couple of things. I'm thinking if you might come across a person in your communities with this, we do want to warm this person, but slowly and gently is how we're going to go about it. We don't want to be rubbing the extremities so much. You really want to focus on raising that core temperature because that's where all of our most important organs are. So we're not going to focus on rubbing the hands or applying heat packs to the hands or legs. We're just going to focus on the core. We'll check a pulse for a full minute. It might be quite hard to feel. And if the pulse is present, these folks are really, their hearts are quite sensitive to being jostled. So you really want to handle someone really gently if they present with moderate or late hypothermia. And I have put avoid massaging extremities a second time, so don't do that. For more on this, I would really encourage folks to do a first aid course. Some wilderness first aid courses are quite interesting too. They sort of teach a response to hypothermia, but when you don't have lots of supplies. And there's quite a lot to this. Managing someone who's hypothermic can be quite complex. So beyond the scope of today to take it more in depth than that, but I just wanted to communicate some of the basics about that to folks. Now, obviously, we don't want people to be in this situation at all. And hypothermia, for the most part, is quite preventable. there's quite a lot of things that we can do for it. So I just like to run through some of those pieces, some of those components that we can do. This is what I communicate to our communities, especially elders in the communities. I've been doing these workshops through the winter season, and yeah, just sharing some practical tips on how folks can stay warm. So number one thing that I communicate is layering. Layering is super important. And generally, we just recommend that people have at least 3 layers on cold days. And the fabric makes a difference in what you're wearing. This little stick figure is saying cotton kills for a reason, because on the inner layer that's closest to our skin, what we want from that inner layer is to be a fabric that pulls the moisture away from the skin and doesn't keep that cold wetness on us. Cotton is a material that's very comfortable to wear, but it will stay wet if it gets wet. And so what we really encourage is not to have cotton as that primary layer against your skin. Instead, synthetic fibers like polyester, nylon, or natural fibers like merino wool and silk can be helpful there. In a middle layer, we want something that's warm. Cotton is okay here. Cotton, like I said, comfortable, warm enough. You can put it as a middle layer, no problem. I like using fleece if I can, or wool is nice here. Down can be expensive, but also is very warm. And then finally, for the snow and the rain and the wind, we want the outer layer to really be windbreaking and waterproof if possible. So this is what I walk people through when I do these community workshops. Also encouraging folks to make sure they're wearing accessories, right? So we want people to have hats, their faces covered, good socks and gloves. This just is very basic, but really does make a big difference. I also encourage folks to carry emergency blankets with them. I take one of these out whenever I go into the outdoors trail running around. I hope people in the room are familiar, but if not, they're a really thin plasticky material that can reflect up to 90% of body heat back to the wearer. So the purpose of these, as is in the name, is to be like just one final layer that you can put around all your clothes that will make like a bit of an oven. The idea is that it traps the heat inside. These emergency blankets fold down very small, so they're very easy to keep in a purse or a pocket and carry around with you if you find that you're stuck out and it's too cold. We really encourage individuals to stay hydrated. It's quite easy to forget to drink enough water in the winter. I'll have a sip now. We're not sweating so much, but in the winter, we lose a lot of water through respiration. And that's a bit of a sneaky way that we lose water. So being hydrated keeps like enough like blood pumping around our body to keep us warm. We encourage folks to drink warm fluids and avoid alcohol and caffeine. I'll just add a comment about alcohol because alcohol is quite a sneaky substance. What alcohol does in the body is that it causes the blood vessels that are in our extremities to relax. So if the blood vessels relax, there's more blood that moves from our core to our arms and legs. And that gives us the sensation of being warm because our skin might get warmer. But in reality, that is actually pulling away warm blood from our core, from the center of our body, which we said is what we want to protect. So some people reach for alcohol to try to warm up. It will give you the sensation of warming up, but without actually warming what's most important, which is your vital organs. So we recommend avoiding it. The foods we eat also make a big difference. I'm no dietitian, but I'm excited to share this with you. This has been important learning for me to do recently, just being mindful about what type of food I'm eating in the winter. Foods that are rich in fiber will actually take longer to digest, and our body temperature will be kept a bit warmer because of that. Also, if you're able to reach for something with whole grains, that is sort of a complex carbohydrate that will keep you full for longer versus sort of simple carbohydrates, as well as iron-rich foods to help that circulation, to help the oxygen to get around our bodies. This is a big one for many of us are iron deficient out there, so really trying to focus on that. For more on nutrition, I often direct people to access the 811 number. A lot of people know 811 as the number that you can call to speak to a nurse 24/7, which is true, but they do have additional services. So Monday to Friday during roughly office hours, I don't know exactly when, 811 um, number has registered dietitians who work on the phone lines, and you're able to call a dietitian and speak to them over the phone. If you have questions about how to incorporate some of this food into your diet or what exactly you should be focusing on, I would really direct folks to try accessing the dietitians through 811. Like I said, this conversation is mostly focused on individual um, factors and things that we can do to prevent cold health risks, but there are some community ideas that I'd like to share as well. So um, one thing that would be really interesting for you to talk to your organizations about is how you are encouraging or incorporating or promoting check-ins. Um, just neighbors checking on each other or having a winter buddy system. There's different words that are going around for this, but check-ins are really, really important during extreme weather and during emergencies of all kinds. Social isolation increases the risk of poor outcomes during extreme weather. We saw this really clearly in the heat dome in 2021, that individuals who were alone at home were much more at risk of health, poor health outcomes, including death. And so there's lots of different ways. People are experimenting with different ways of how to encourage checking in on each other. So that would be something to consider. Your organization, depending on capacity and funding and space, might be able to actually host a warming center or a space. And if that's not possible, we really encourage that you are distributing those news of where those are to your community spaces. Some of them open up specifically during cold weather emergencies, so it's really important for those pop-up spaces especially that we get the word out. Evidently, keeping those priority vulnerable populations in mind, outreach for your organization might look like a lot of different things, but worth considering how you might do that. And increasing communication, right? We want to make sure that we're showing up during these cold winter days and pointing people towards resources and reminding them of what's available to them, I think is a really important way that we can stay connected. Additionally, probably this is the number one thing, is that so much of this prevention of hypothermia and other health risks comes from lack of preparation, which is connected to lack of knowledge, right? We want to be people who are staying up to date. And so on the slide, I just listed a few places that I've recently discovered and I'm accessing some of the resources. So Vancouver Coastal Health, their public health team sends out seasonal readiness updates. These updates are pretty handy. They send out like content and health guidance for community organizations supporting their communities during extreme weather events. Mostly they're doing heat and cold, but I believe they're planning to expand to additionally like air quality or flooding events as well. So you can just sign up to be on the email list by the email that's on the screen. Making sure that we're following what's happening in the weather. So Environment and Climate Change Canada is the official Canadian weather service that's used by health authorities and by government officials. You can check their website, but there's also a couple ways that you could be a little more involved if you wanted to. You can get early warning email notifications by contacting that email address also on the slide. And I just recently signed up for this. You can sign up for Environment Canada Alert to Me. You can make an account, and what this is that you customize the alerts that you'd like to receive. So maybe you mostly care about extreme cold and snowfall warnings. You can select just those two. You can pick the region of the country that you're in, and then you'll be updated when those alerts are active. Just for a provincial hub of information, I would direct everyone to Emergency Information BC. And there's another website or group called Prepared BC. And one really nice thing that they do is they make some really nifty, very thorough checklists. So over here, I have a little screenshot of one of their checklists, which is the Severe Winter Weather and Storm Preparedness Guide. These checklists are really handy. They take you through everything from what's the difference from an emergency bag to a grab and go bag, and what should I pack in each of those. to preparing for power outages in your home and making sure that you've covered all your bases, and identifying winter buddies and people to check on. So there's lots of information out there, sometimes a dizzying amount, but this has sort of been my starting place for sources. I just want to take a second and see if pause. I don't have eyes on the chat right now, but I'm wondering if Laura or Olivia, are there any pressing questions that have come up in the chat?
Yeah, Lisa, so thank you very much for everything you've presented so far. And there was a question from Linda asking, what, if any, are the long-term impacts of hypothermia?
Hmm. Linda, great question. I would think that's a tricky question to answer. Often we see hypothermia in addition to other diseases or other things happening. So if someone is in an accident and they develop hypothermia, sort of that worsens whatever else is going on. Some individuals can have brain damage if they get to a stage of late hypothermia and need advanced resuscitation. But I don't believe that at mild hypothermia, if someone is rewarmed or probably even moderate, I don't think there's anything too lasting. What I can do is, that's about all that I would be able to speak to it, Linda. It's a really good question. If there's anything that I just said that wasn't accurate, I'll just check after this presentation. I'm happy to communicate that with folks. Perfect. Also, I will say, I know I'm moving quickly. I am an excitable person who likes going fast. I fully intend to leave my email address and contact information. So if you have any follow-up questions or things to clarify that you don't have a chance to ask, I'm very available to field those via email or via phone call. That's okay too. Perfect. Thanks, Laura. So moving on to talk about falls. Falls are a very, 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 very common experience, unfortunately. I was really shocked to find that it's about one out of 3 adults over the age of 65 will fall every year, which is massive. Additionally, the older that individuals get, the higher risk of injury is. And these injuries can really vary, right? The consequences of falls are very broad. There's fractures and there's head injuries on the one hand, but even sort of more deeply and maybe less physical, falls have really big impacts on quality of life. They often perpetuate a fear of falling or a loss of confidence. And often, like older adults in particular who've fallen multiple times, tend to sort of self-restrict what activities they do. And that has really big implications for their social life and them accessing healthy food. So there's all these kind of domino effects that can sort of start with falls. And of course, in the winter, falls are really important. When I worked in emergency, I was so shocked by these snowy days like the one that we're having today. It would just be individual after individual after individual coming in with slips and falls, lots of broken wrists of people falling back onto their wrists. And I was really shocked by how prominent this was. It's a little bit beyond the scope of today to explore a thorough fall prevention because the reasons why people fall are very, there's a lot of them. There's so many reasons why people fall. I take that as a bit of a positive in that I personally see that there's lots that can be done to prevent falls because there's 5 or 6 or 7 big reasons why people fall. There's 5 or 6 or 7 things that we can act on to prevent them. But I just wanted to focus for today on thinking about winter falls in particular. What can we do to prevent winter falls? Lots of things, thankfully. Here we are. So I'll just run through a few tips that I share with community members and that I wanted to pass on to you today. The first that we think about is good traction. This makes a big difference to have good shoes with reliable tread. I often point folks as well towards using ice cleats or crampons. These can be very good given a little bit of education. I find that there are a couple nuances to how to use them. For example, if you've ever used ice cleats or crampons, getting them on can be challenging. Sometimes I teeter on one leg while I'm trying to put on my ice cleat on the other leg, and I think I'm going to fall over at this moment while I'm just trying to get them on. So they can be a really good tool, but need a little bit of support, I find, so that people can use them safely. We recommend that if individuals have mobility aids, that they keep using them in snowy weather. This photo here on the upper right-hand side is of an ice pick. So these are little attachments that can be purchased, I believe, at places like Shoppers Drug Mart, at different pharmacies, at big stores like Walmart or Amazon or Superstore. And they just clip onto the edge to the end of a cane or a walker or a walking stick to give you a little bit more traction in the snow. Even if you're not someone who typically uses a cane or a walker, we do suggest that you could use walking poles. Those just add a couple extra points of contact. There's a few behavioral changes that can be made too. So designated sidewalks, as long as they're shoveled, of course, which is the challenging part of living wherever we are when there's a big snowfall like the one we've just had. Lots of people fall when they're getting in and out of cars or on and off of transit. So that's a moment to be really mindful of in particular. And if you're not using your hands to use mobility aids or walking sticks, keep your hands free if you can, to try to cushion your fall on your way down if that's what's going to happen. I would give a really, really big pitch for exercise and strength. The exercise has been shown to be very effective in preventing falls. I know that this probably, we hear about the benefits of physical activity from so many different sources, but in particular for fall prevention, a study that was done that compiled a bunch of different studies found that there were some exercise programs where they went for just over 3 hours of exercise a week, and a focus on strength and functional exercises. Functional exercises being like movements that we regularly do in our daily lives, reduced falls by up to 40% in the older adult population. So this wasn't in particular for winter falls, but the research is there to support that exercise is like a very, very effective way to prevent falls. And when we think of all of those dire consequences that I discussed, this becomes a really important part of our community's health, I believe. What's recommended is sort of the general recommendations for adults is to have about 150 minutes of exercise per week. That's about 30 minutes a day of exercise. And I will say, as someone who personally likes to be active, of course, the winter changes the ways that we access exercise. I like we've discussed, I like to run, but when the sidewalks are snowy today, or when the trails on the mountains are icy and slippery, I have to have alternatives so that I can keep being as active as I would like. And I would just encourage individuals and communities to make a plan, like to really think about this and say, okay, this winter, what's my plan? What am I going to adapt? And there are so many resources for folks who have access to the internet and to YouTube in particular. There are just so many videos that offer different variations and types of exercises that you could do at home with minimal equipment. For example, Indigenous Sport BC has a series of workouts. I've added that screenshot there. A full body chair workout could be done 16 minutes of your day. And these exercises will directly connect to fall prevention, which we really, really care about. So that's my pitch for exercise for the room. I'll just keep moving. I think now's a good time for us to move on. So that's my spiel about fall prevention. We've talked about hypothermia and we've talked about falls. And what I'd like to do now is shift a little bit to try to create some space for us to share what we're already doing. So like I said earlier, I've spoken to some of these things a little bit more at the center of this diagram. And what I hope to hear from you all, beautiful people in the room, is some things that you're doing on a slightly broader level. So my question to you is, how is your organization supporting the health of your communities this winter? What I've done, and we'll switch to this board in a couple of minutes once I've explained it, but I've made a whiteboard for us that mimics this shape from the individual levels to the community levels in the middle to the sort of broader society and policy levels. I've made this as an interactive whiteboard that I'll walk you through in a few minutes, but you can also see I've divided this circle. So in the top left of the circle, we have in particular hypothermia prevention. On the top right of the circle, we have preventing winter falls. And then the whole lower half of the circle, I've just kept for general winter wellness, for things that don't necessarily work that you do that doesn't necessarily prevent winter falls or hypothermia. And what I would ask of you, for those of you who are comfortable using the whiteboard once I explain it, I would hope that you would be able to write in on a little sticky note that's available in the whiteboard what is the work that you're doing, or one of the projects that you're doing, and sort of situate it, locate it on that circle. So if you're doing a community level intervention for hypothermia prevention, for example, at Reach Community Health Center, we are delivering cold weather preparedness workshops to community partners. This is sort of a community level intervention that we're doing. So I would pop it right there. On an individual level, I've been distributing ice cleats to seniors and teaching them how to use them. That is an individual level action that is connected to preventing winter falls. And my reason for going for this or wanting to facilitate this exercise is twofold. One is that you might celebrate and recognize the work that you're already doing. I imagine that there is just an incredible myriad of projects and programs and ways that you're supporting your communities, and I would like to see that mapped out. You can write as many sticky notes as you want. It doesn't have to be just one. And I would also think that maybe this is a bit of a knowledge sharing. With your consent, if anyone has any objections to this, please feel free to communicate that with me. I would like to distribute this to participants after the workshop, that you might refer back and say, what else could we be doing for hypothermia prevention in the community? And you might be able to track that, oh, at this organization, they have a program that sounds really cool. I'd like to learn more about that. So my hope is that it's celebratory for you to recognize the work that you're doing yourself, and perhaps a way to inspire and connect with other organizations who are supporting the winter wellness of their communities. For those of you who don't want to bother at all with a Miro whiteboard, that's understandable. Also, just feel free to contribute in the chat, and maybe just share what you're doing, and if you could situate like what level of action it is, if it's an individual or community or society policy level action, and which organization you come from, please feel free to do that. And if you're able to unmute and speak, I'm also happy to hear what you're doing directly. So I think with that, I will pass over the control to, I believe, Olivia, were you going to pull up the Miro board for everyone to use there?
Sure, yeah, I can definitely do that,
Sure.
Lisa. Yeah.
Awesome. Perfect. And meanwhile, I'm just going to send everybody the link to this Miro board. So you should all be able to click on the link that I've just sent in the chat. Oh, I see there's already some people in there, and you have all funky names as you navigate around. I'll just draw to your attention, there's on the bottom right of your screen, if you're on Miro, you can zoom in and you can zoom out. This is actually a very large document. That's why the sticky notes look so small. So you can zoom in to see. And then once you're in, you might be able to use the arrow keys on your keyboard to move left and right, or on the sidebar of the screen, there's a gray bar that you can drag to move up and down. So let's just take 5 or so minutes for folks to add what you're doing. I'm really curious. If I can't read it now, I can read it after and pull some of the things together. And also feel free to share in the chat if anyone doesn't want to bother with Miro. What are you doing to support the health of your communities this winter?
And will both Laura and I, for those of you that do want to share some ideas in chat, we're happy to transcribe what you put in chat into stickies in the respective Miro, like quadrants of the Miro board. So happy to support in that way on our end too.
Beautiful. I see lots of people figuring out this Miro board live. That's really exciting to see. It can take a couple seconds to sort of get the hang of it, but that's great. I see we have a hand. I'm wondering if Rob Bergen would like to speak up. I hope I said your name correctly.
Hello there. Can you hear me?
I sure can. Hi.
Hi. I'm having some technical difficulties. I'm a person with vision loss, so I'm having challenges. I can't use the chat, so I'm missing out in being able to participate too much. But I definitely have thoughts and things that I could share for sure.
Oh, Ron, please share. I was hoping that by giving folks the option to either use the whiteboard or the chat or speak up, that we can cover our bases. So please, the floor is yours. What would you like to share?
Kind of what I'm getting from here is I am in the Greater Langley area, and I am on numerous committees for accessibility, inclusion, transportation challenges, etc., in all weathers and all conditions, and advocate very much for extreme weather infrastructure, which I'm on numerous committees and saying that we need to advocate more for centers like this to have in our community when these kind of things happen, because every year we go through the same thing. Who's opening the warming station, or
Mm.
who's this or that? And quite often, we in a meeting discussed that last week, and about people expect churches to be doing all that kind of stuff. I'm not saying that's a bad thing, but they also have their own programming and they have their things. And then, as you hear in the media, a lot of people don't want um, unhoused or people they don't know in rec centers that are close to where kids are playing hockey, or daycares or whatever. And so I really keep saying we've got to stop talking about it, but we've got to address the extreme weather things, and this is for all kinds of weather, including the floods and the heat domes and stuff. And we have to have budgets and plans in place in our cities and municipalities so that we are prepared for that. So not every year we go through this same thing. Oh, who's got the doors open? And out in Langley, it's limited. And one major one that everyone expects to be apparently has been at capacity for the last couple of days. And I also work with people as outreach. I do the Ron Cares Community Care Kit program, which lately I've been out putting out toques, gloves, hand warmers, that kind of stuff, along with full toiletry kits too if they need it. But lately, in the last number of days, it's been making sure that people, on the streets and in walkways and buildings and stuff are getting some warm up products that they do. And in the summer, I do the same thing. I give cooling kits out on the streets with water bottles and all different things to give a chance the people to survive the extreme weather. So anyway, we are doing some things out here in Langley. And just for those that don't know, quite often the Langley Senior Resource Society would be an open building for people that have challenges, and especially for the aging population, which quite often they can go, but they unfortunately are closed indefinitely right now due to a major leak caused by the freezing weather. So just for heads up there for people that might think that they could go there, right now that facility is closed.
Amazing.
In Langley.
Wow.
So that's some of the things we're doing out here in
Thank
Langley,
you.
and just trying to make a difference. And to me, it's getting more people motivated to say, more of us need to step up and be part of the solution. The talking about we need these things
Uh-huh.
is old. It's past. It's
Mm-hmm.
now we need groups like today, people here, which I'd assume mainly stakeholders. Let's work together and put pressure and stuff on our municipalities and our cities to have a
Mm-hmm.
better program in place so that we don't keep having this, oh, who's going to do it this time? You
Yeah.
know?
Ron, thank you for sharing. I appreciate the words that you've shared. I appreciate the inspiration that I hear in what you're saying. And also, I really recognize that you've identified some of the work that you're doing on different levels. So working on that individual level to be handing out like very practical supplies, and also advocating for improvement in our coordination of winter services. So I commend you, and I really thank you for the work that you're doing, and really appreciate you sharing. Thank you. I'm noticing that we're just about closing out of time. I wish we could chat for another hour, but here we are. I'm wondering if we maybe just have one final, like a short comment or a quick question. If not, we can leave the Miro board open for folks to keep working on if they'd like to. I'll read through the Miro board when we're done. And like I said, I'm available to answer questions and field questions after this webinar is over.
And we do have Linda has her hand up, so maybe we could invite Linda to give a comment.
Beautiful. Hello, Linda.
Can you hear me now?
We can, yeah.
Okay, my question is around public transportation. So I'm wondering how long people are standing out in the cold before waiting for buses, for example, before it's going to really affect their core temperatures. And whether there's any, are you working at all with TransLink around that? I just heard from a friend of mine that the downtown bus routes, I think, are instead of 10 minutes apart, they're 12 or 15. And for people to be standing out in the cold for that length of time, especially elderly people, it scares me. And I don't know, I don't have a suggestion, I'm sorry. I wonder if it affects them and if there's any plans to work with TransLink around that.
That's such a great question, Linda. Thanks for sharing. It's a bit hard to say, to part of your question, it's a bit hard to say exactly how long it takes for someone's core temperature to drop, because it really, really depends on who they are and whatever combination of of risk factors they have. What I encourage folks, in particular, waiting for the bus on these snowy days, depending on where you are in the province, you might be out for a really long time. And so I just encourage people to be prepared, to pack the extra layers, to bring an emergency blanket with them, to have good accessories, to bring a flask of warm tea. And maybe this is the emergency framework, but expect to wait a long time and maybe be pleasantly surprised. So those are sort of, I would encourage those preventative things for everyone. I don't know about plans to work with TransLink. That's a bit beyond what I know, but I'd be curious to look into that. And I really hear a lot of concern for communities in that specific question that you asked, Linda, about what about waiting at bus stops. So thank you so much for sharing that.
Good.
Can I make another comment?
Maybe I'll just check in with Olivia and Laura, Ron, if that's okay with you.
Okay.
To the United Way team, how are we doing? Would we like to close out? Do we want to sneak in a final comment? If not, Ron, I'm available to chat after if that's better for you.
It was just about transit because I serve on the I serve on TransLink's user advisory committees. So I can ask some of those kind of questions at the accessibility level. It's a good question about.
Yeah, that would be fantastic, Ron. That would be great.
Thank you.
So we are at time. We are at 2 o'clock. On behalf of the United Way BC team, I just want to extend a huge thank you to Lisa for your time and your expertise and all of the wisdom you shared with us today. So much information in this webinar. And I also really want to appreciate the invitation to co-create and co-share ideas and strategies and responses that different folks are engaged in at both individual levels, community levels, and broader system and societal levels. So just thanks for inviting that opportunity to collaborate and share ideas and strategies together. I think I agree absolutely that that generation and exchange of ideas enables us all in different and really impactful ways. So a huge shout out to you. Thank you everyone for joining us and taking time out of your day to be with us today. The webinar recording and slide deck will be shared out tomorrow. So feel free to use that and share the link and disseminate it more broadly within your own networks. And there will also be a short follow-up evaluation link we send to you, as well as a link to this Miro board once Lisa's had a chance to kind of take a look at it and finesse it as needed, or kind of stretch font sizes and all the rest. So follow-up materials coming your way. Thank you all for being here, and wish you a safe and warm afternoon. Thanks again.
Thank you.
Should we all sign off, Laura?
Yeah, that sounds good. All right, take care, everyone. And Ravi, if
Thanks,
you want to
everyone.
end the webinar.
Take care. Bye.